hope you're enjoying this weather, and I hope you take some time to actually get out and enjoy this fresh air today and tomorrow, especially during this time. Your physical, but also your mental health is extremely important. And so while you're out and enjoying this weather, I want to remind folks that it's important to continue to keep your physical distancing, wash your hands. This is a new normal, and so as we see this weather warming up, it's extremely important that we understand the new habits that we have to get used to, and wearing a mask is definitely one of them, especially as we come into this upcoming Memorial Day weekend. And so this is a time where we usually gather, go to the park, probably go by some friends and families or neighbors' house to enjoy a good barbecue, or take a road trip somewhere across the state. But whatever you're going to be doing, it's extremely important that you continue to adhere to the best practices, like I talked about before, keeping your distance, making sure you're not gathering in large groups, wearing a mask, and continually washing your hands and being mindful of others. I do understand that there are multiple municipalities across the state that are lifting their orders, but this does not mean that we are going back to normal. We all have to take ownership in what's happening right now. And so it's important that we look at our own actions and do what we can to continue to fight this virus. And in order to fight this virus, you have to continue to test. And so I want to give a quick update about the 2 National Guard locations. But I know that we have some folks from our federally qualified health centers. They're going to be talking about the great work that they've been doing. But nearly thus far, we've seen about a little over 14,000 tests that have been conducted at the UMOS and Midtown sites thus far. And they're going to continue to remain open until up until this Saturday. We're going to revisit to see what happens, and those hours will continue from 11 to 8 a.m. But as we talk about those particular testing sites, again, we do have 5 community health centers, a total of 17 testing sites across the Milwaukee County and the city to make sure that folks get tested. So if you are feeling symptomatic, please call 211 to get tested and to get an appointment to get tested. And I know that later in this briefing, we want to have representatives from Progressive and 16th Street give an update about how to make an appointment and what to expect from a visit. But I also want to make sure that I give a major shout out to all of our EMS workers. This is National EMS Week, and so I want to say thank you to our Milwaukee County EMS providers who do the work every day to make sure that the call for help is met. And so, during this crisis, the demand of these services has definitely increased, and particularly, I just want to say thank you to the folks who are on the front lines, making sure to care for all of our Milwaukee County residents. We wouldn't be able to do this without you. But by what you are doing, you are providing and gathering a lot of data that makes up the Milwaukee County COVID-19 dashboard. And you've really been helping us out in implementing the strategic response that we absolutely need in this community, and continuing those continuity of operation plans for all departments across Milwaukee County. But more importantly, I would say assisting all of our colleagues at the city and throughout Milwaukee County to make sure that we're doing everything that we can to bring a great response. So I just want to say thank you again for all that you all are doing for Milwaukee County, our EMS workers, our frontline workers. And so I just want to say thank you. I don't think we can thank any of our essential workers enough. So with that, I'll hand it over to Mayor Tom Baer.
Thank you, County Executive Crowley. Thank you for your leadership on this issue as well. Again, the sun is shining today. It's a gorgeous day, and probably everyone in southeastern Wisconsin would like to simply say life is back to normal. And I certainly would like to say life is back to normal. And we know that there are a lot of people who want to act as though life is back to normal. But I just want to remind people, and Dr. Weston, I don't know if he'll have the 2:30 statistics. I don't know if he's got access to them already. But we still have over 5,300 people in this county who have tested positive for COVID-19. And as of this morning, the number of people in the city of Milwaukee alone that have tested positive is close to 4,200. So that's 4,200 people just in the city of Milwaukee who have tested positive. Over 250 people have died. And Dr. Weston's going to talk about what we're seeing from a hospital perspective. I know on the south side, the 16th Street Health Clinic has seen a tremendous amount of people who have come through their shop, and a significant number of them have tested positive. And we have to be mindful that as much as we would like to say that we're through this, we're not through this. So when the county executive talks about the social distancing, when he talks about taking those safe steps, I want to put an exclamation point on that. Because one of the things that I think people have to understand is just how much we are still in the danger zone. We are clearly still in the danger zone, and I'd like to pretend that we're not, but we are. I want to also put an exclamation point on the use of face masks, particularly when you're interacting with other people. If you want to go outside and there's nobody around, that's one thing. But if you're going to the hardware store, you're going to the grocery store, you're going to pick up dry cleaning, you're going to go pick up food, those are the times when you can infect somebody or someone can infect you. And so it's so important for us to keep our guard up, literally keep our guard up, so that we're not hurting other people and other people are not hurting us. I want to give a special shout out to our community health centers, because in the long run, they are the ones that will continue to be here to treat the people in our communities who need to be treated. And so we are very, very pleased that we had the National Guard and have the National Guard to be with us during this short period. But in the long run, it's going to be our community health centers along with our health systems that are going to be here to help the individuals who need to have a health home and need to get the treatment that's necessary for them to battle COVID-19. So again, we're getting closer to the weekend. People are antsy. People want to get out. But I would love us to be in a situation where we can say all clear. We're not there yet, but we're certainly doing everything we can to get to that point. And with that, I'll turn it over to Dr. Weston. Doctor?
Thank you, Mr. Mayor. Good afternoon. First, I would appreciate and echo County Executive Crowley's recognition of EMS Week. We all acknowledge and appreciate what each of our EMS providers do for our nearly 1 million citizens in Milwaukee County, day in and day out. I think in particular during these challenging times, your unwavering presence on the front lines, protecting and aiding our communities speaks to your engagement, your sacrifice, and your service. So thank you on behalf of all of us. Moving on to our numbers, as the mayor mentioned, we do have updated numbers. We have 5,531 cases of COVID-19 in our community and 244 individuals who have died. These numbers, over 5,000 cases, over 240 deaths, have occurred over the last 2 months in an artificial sort of setting. It has not been occurring with us going to restaurants, gathering with families, and exercising at the gym. Rather, COVID-19 has been constrained in its spread by stay-at-home orders, closed storefronts, and canceled gatherings. We've slowed the flow of this river with a dam that we're now dismantling, and there's no reason to think that we're not going to get wet. In fact, we've already seen over the last few days increases in the combined number of COVID-19 patients in our local hospitals. Whereas 1 week ago, we had 146 COVID-19 patients in our area hospitals, we now have 183. This is a concerning 29% increase in COVID-19 patients in our local hospitals. We'll continue to monitor these and other indicators as we move forward to the next phase of COVID-19. However, this is a reminder that we're far from out of the woods. Although our county, our city, and our municipalities have made great efforts to build up the infrastructure to enable us to face the future of this pandemic, COVID-19 is still with us, and we must remain cautious and vigilant. So reopen businesses with humility, travel, but with caution, and pull back physical distancing with care and understanding that we're now facing probably the most dangerous period in our fight against COVID-19. Thank you and stay safe, and I will hand it back to Catherine.
Thank you, Dr. Weston. We will now hear from Sarah Francois with Progressive Community Health Centers.
Good afternoon. Thanks so much for inviting Community Health Centers to be a part of this call today. As County Executive Crowley and Mayor Barrett mentioned, there are 5 community health center organizations that serve the greater Milwaukee area. We have been testing for many weeks now, most of us. And although the National Guard sites have popped up, which is great, and they provide an excellent access point, we really want to ensure that people in the community understand that this is a long game. The National Guard sites will likely not be here forever. And we want people to know that the most important step they can take right now in staying healthy for the long run is to really connect with a primary care provider, connect with a doctor, a regular doctor that you can go see for routine issues. Community health centers provide a great access point for that. And the best part of my job every day is to be able to say that we never turn anybody away. So regardless of insurance status, immigration status, your community health centers are here to serve you. Progressive Community Health Centers, we are on the north side of Milwaukee. We are still in a little bit of a hot zone. I know the south side is getting hit really hard right now, and 16th Street, we'll talk about that in a minute. But here on the north side of Milwaukee, 53208, 53206, we're still seeing some increase in cases as well. At Progressive Community Health Centers, we are testing at our Lisbon Avenue Health Center location, which is on 35th and Lisbon. We are testing by appointment only, and that is pretty standard across community health center sites in the city. And I know that that has been a deterrent for some, because obviously if you go to these National Guard sites, you do not need an appointment, nor do you necessarily need to be symptomatic. But I don't want people to be discouraged by the fact that we're requiring folks to get appointments. We are able to test many times here at Progressive same day very, very easily. So we have plenty of appointments available. If people are experiencing symptoms, and again, symptoms are very broad. So we're hearing that, you know, people are saying, well, I don't feel too sick, so I'm worried about calling, things like that. Symptoms have now expanded from everything from the, you know, standard cough all the way to diarrhea, you know, just feeling general fatigue, definitely losing sense of smell or taste. Those all count as general symptoms. So we're encouraging people, if you don't feel well, really at all, chances are you're going to qualify for a test at one of our sites. And so we're encouraging people who may be on the north side and want to get tested to call our triage line, which is 414-882-2040. Again, at Progressive, so that's for Progressive only, 414-882-2040. However, you can get connected to a community health center site no matter where you live by contacting 211. So you'll put in your zip code and they'll let you know what community health center might be closest to you. And again, our goal here is to ensure that we're connecting people to a medical home, because the virus is not going away. We know we might actually see spikes and increases. We might see a little dip for a few weeks or maybe a month, but eventually you're going to need to get care somewhere. And especially if you're testing positive, you're going to need to get care somewhere. So we want to be sure that people have access to that. Community health centers also provide assistance with insurance. So if you don't have insurance, if your insurance might be lapsing, you're not quite sure what your current status is on insurance, all of us have financial counselors and staff that can help you work through all of those issues as well. Many of us provide other services. So for example, here at Progressive, we're currently offering emergency dental services on a walk-in basis for folks who might be having oral health issues. So we really want people to view this as the place that they can go to not only get tested, because we're all still offering those tests, but also to get that long-term care, because that's really what's going to be needed as we continue to fight the virus, fight the spread. And so we are very honored to be a part of that. We have been around here at Progressive for 20 years, and we intend on being here 20 more years. So we're your community access points, and we want you to be sure to connect with us if you need that care.
Thank you very much, Sarah. Very informative. We'll hear from one more guest. At this point, I'm not seeing any questions in the chat, so just a reminder, if you have any, feel free to ask a question or let me know if you'd like to ask your own question. Lastly, we will hear from Dr. Elizabeth Pine, Medical Director of 16th Street Community Health Centers.
Good afternoon. Thank you for having me. I absolutely agree with everything that's been said this afternoon. At 16th Street, we're part of a team of screening sites across the city. We are on the south side, and we are seeing an extremely high rate of positive cases of COVID. So we've recognized this, and we've actually increased our testing over the past week, and so we can reach all community members that need a test. As has already been stated, we are seeing patients that are calling for many reasons, and recommend that most people feeling sick right now get tests. And so we are trying to do this in the most efficient way possible. We also are requiring appointments, and that's so we can get patients registered ahead of time, cut down the amount of time that they're at the clinic. We are doing everything through a drive-through service, but we want to make sure that we're getting people in and out as quickly and efficiently as possible, and that we have the right contact information so we can follow up afterwards. So that's a large reason that we do require appointments. However, we are able to test hundreds of people every day. So for the most part, we're able to do same-day appointments, so we're not having patients wait. When you do call to make an appointment, you'll be given an appointment time. There is some flexibility as long as you have an appointment for that day. We can coordinate with you the best time to get in. Like I said, we're getting all of your contact information, solidifying that, so we're able to get patients their results generally within 24 to 48 hours. And then we can also schedule a follow-up appointment right away. We know that symptoms can get worse pretty quickly, so we follow patients all the way through to the end of their potential illness, guide their families, help contacts get tested as needed. And we have essentially our entire clinic open right now, all departments. So we know that this pandemic is not affecting people just medically, but in other social service type ways. So we are able to help patients get registered for insurance if they qualify, as well as other supportive services. So we want to make sure that patients know that we're able to take care of them fully during this time. And it's an important time to get connected with any clinic, but we're available as well. And just personally as a provider, I'm in contact with a lot of patients who have been tested positive. Like I said, many of them did not really think they needed to get testing. And after discussing this, we found out that they needed to and they're positive. We really want to emphasize that families need to remain quarantined as well from the time that a patient develops symptoms all the way through, when they get tested and through their quarantine time. So as other people are moving throughout the community, it increases the risk of spreading this further. So we want to make sure that everybody is remaining at home that may be symptomatic or connected to somebody that's symptomatic. So give us a call if you need a test.